Association of Resident Doctors strike has entered the second day despite federal government's disbursement of monies for doctors and the healthcare sector.
It's a headline you've seen before and again and again. As of today, Nigerian resident doctors are on strike. And this is not the first time. In fact, Nigerian doctors have gone on strike over 25 times in the past 10 years. And the question everybody begins to ask is why? An average citizen might think, but doctors are well paid. Doctors are a prestigious part of society. And you will be right anywhere else in the world. But that is not the case for a doctor practicing in Nigeria.
I decided that I was not doing clinical medicine anymore. I decided I'm not doing anything clinical anymore. Why? The workload is exhausting. It's not that bad that I have to finish work maybe around 6 or 7. I have to hit the traffic again, back to my house, go back early in the morning again. It's just too much.
The 19-point request from the National Association of Resident Doctors isn't just a list of demands, it is a horror story. It tells a tale of poor working conditions, decaying infrastructure, delayed and owed salaries, and the punitive downgrading of the medical profession. In today's episode, we are taking a closer look at the Nigerian health system, and through each chapter, we'll be telling a story how Nigerian medical doctors operate in a system that has been designed to keep them underpaid, overworked, and systematically abused. I spoke with medical colleagues to help you understand that one thing is clear: the Nigerian health system is broken, and the government is not telling you the full story. The story of Nigeria's healthcare system wasn't such a gory past. As a matter of fact, in the 1960s and 70s, Nigeria was a hub for medical tourism in Africa. Yes, in fact, Nigerian medical care was so good that even members of the Saudi royal family came to seek care in Nigeria, primarily at the University College Hospital in Ibadan. King Faisal, the former king of Saudi Arabia, traveled to UCH Ibadan for medical treatment, a testament to the hospital's high standards and reputation at the time. It was the golden era of the nation, around the time where a leader once said, "Nigeria's problem is not money, the problem is how to spend it." Many of these statements have been proven to be correct and have even been corroborated by leaders such as the former Minister of Health, Dr. Olorunnibe Mamora.
The decision to be a medical doctor stemmed from an event that happened, I think it was in 2002 or 2003 when Obasanjo was our president that time, and there was a strike. My mom lost her secretary because she was pregnant and there was strike. Nobody was going to work. It was so sad. And that day I wrote it down that I'm going to be obstetrician and gynecology specialist just because I want to save people's life. This is 2025. I'm telling you that nothing has changed. The dream to become a specialist, Angie, is still there. But I can't lie, that dream is it's slowly waving away. It's just dying.
Sadly, the reality is that while countries like Saudi Arabia, who once depended on Nigeria for healthcare services, poured investment into their own healthcare system, Nigeria chose a different approach: settle for less, leaving the system to absolute rot, neglect, and systemic fractures that have delivered a broken healthcare system for over half a century. The Nigerian healthcare system is now a ghost of its former self, and its doctors, who are recognized as the forerunners of the Nigerian healthcare system, are left to nothing but excessive working hours, poor living standards and remuneration, and punitive downgrading of their qualifications. There is also a problem with numbers. Nigeria has fewer doctors than it did 13 years ago. Currently, there are roughly about 8,500 resident doctors, that is, doctors in specialist training, practicing in Nigeria, servicing a population of about 200 million people. 10 years ago, that number was up by 25,000. Automatically, as a result of all this, Nigerian doctors now suffer having to take over 100-hour shifts each week.
The way we run call in this country as doctors is beyond insane.
They do calls. That call alone, can you be going? You work 8 to 4. You do your call again from 4 to 8 the next day, and you still have to work the next day. I'm sorry, but The present reality has shattered the dreams that I had for practicing medicine in Nigeria.
These burnouts have led to devastating consequences on the health of Nigerian doctors. Sadly, those who have been tasked with the responsibility of providing care for us are now the ones in need of the care that they are giving.
People are doing at least 110 hours in a week. How can a sane person function optimally after doing that kind of hours? Let's be honest. People don't understand that a tired doctor is a dangerous doctor. Some months ago, we complained that some doctors slumped and they died.
Most hospitals will have written for waiver at the beginning of the year. Let's say Hospital A, you write for waiver to recruit also doctors, nurses at the beginning of the year. The approval for you to recruit doctors might actually not come till September, October.
So the question you might be asking right now is, what do doctors really want?
Earlier in the year, when we're also agitating that, okay, let us review, remunerations and all. Now there was a CBA, a collective bargaining agreement. That's what it's being called. They set up a committee, and the committee had the mandate to work out the modality for a new template of remuneration in September 2025 this year. Over time, we just discovered that there was criminal silence. Nobody was saying anything, only for us to start agitating. For us to now hear that the CBA has stalled and all of that. And those are the things that we're saying. That if 10 years ago, there are like 16,000 doctors in Nigeria, and today we are struggling with 8. Now, if in the past I was probably seeing like 10 patients per day, as I speak now, I'm probably going to be seeing like 30 patients. And I'm probably now being paid like 50% less than what I was earning, even when the system was a bit better.
These demands, when you take a deeper look, are very reasonable. To have a better context of this, I returned back from my training in 2012 to come back home and give my services to my country, knowing fully well that my services will be much more impactful right here at home than anywhere else. And when I started my training, at the time, I was paid 172,000 naira, which was around $1,100 at the time. That was in 2014. Now, this salary was fair. Not the best, but it was fair.
When I was doing house job, I was earning less than 200,000. It was over $1,000. As it stands today, the most senior doctor is on comment 7, step 7. His take home is not up to $1,000. $1,000 is like 1.5 million. Imagine that somebody who had probably had post-residency training, like 20 years post-residency training, is not going on with $1,000. One other problem that arose very recently, the entry level for a post-NYC doctor is comment 3. The circular puts the entry level of post-NYC doctors at comment 2. And the consultants who were meant to be employed with comment 6, 4, they are now on comments 5. It will interest you to know, sir, that as we speak today, house officers now end than the resident doctors who trained them. Some of our colleagues that were employed recently at the University of Uju Teaching Hospital, Uju Akwa Ibom, I think they are total net earning now is 222,000. While house officer, who they are even training, earns 267,000. For a country who is shouting about Japa, and if you've also listened to the NAD president, we're even tired of drilling out those statistics every day.
Today, thanks to neglect and poor economic leadership, in today's day and age, that salary is now worth an average of $150 today. A registrar, that is a consultant specialist in training, today goes home with roughly around $350 per month.
Not even the pay, because when I started internship, we were being paid 140,000. Yes, 140,000. That was maybe 2021. Yeah, 2021. I want 140,000 too. But the fact that out of that same money that I'm being earned, patients cannot afford basic drug. Out of that same money, we are paying for patients. We pay for their procedures. We help them to donate blood. We take samples free of charge. We will go and beg in the lab. Please, this baby is about to die.
This constant neglect has left the welfare of healthcare workers, particularly medical doctors, in a perpetual state of decay. And rather than stem the bleeding and improve the healthcare system to encourage medical doctors to stay back, the government has either ignored their needs or created exploitative mechanisms to discourage doctors from seeking placements in places and countries where their skills and expertise are valued.
This same government that's shouting about Japa doing this, doing that, this same government downgraded the entry level. It will shock you that you will go to a clinic, they will tell you that they don't have fig, there's no fig in the hospital store, you will wait. Imagine, as common as fig.
So ideally, the Nigerian government doesn't want you to leave and are not encouraging you to stay either by improving working conditions right here at home. And all these are happening at the same time when Nigerian lawmakers and government officials are among the highest paid politicians and leaders in the world. Take a look at this. Nigerian senators currently receive annual earnings that can range between $170,000 to over $250,000 per year, and in some cases it has been reported higher. This in fact places their earnings that rivals and in some cases exceeds the official salaries of lawmakers in wealthy nations such as the United Kingdom and even the United States, both at $105,000 and $175,000 respectively. Why will a country that can afford to pay its lawmakers over $200,000 per year not afford to pay its medical doctors a living wage and pay their salaries on time?
What is the value? What is the value of a Nigerian doctor in this community? What is our value?
The crisis has become so terrible that young doctors, including medical students, deliberately refuse to enter the residency and the specialist training pathway. And some of them start seeking to either practice abroad in a different country that values their skills, or totally decide not to practice medicine at all, going into ventures such as businesses or working with non-governmental organizations, that is NGOs, as the current state of the Nigerian healthcare system gives them nothing to aspire to. In fact, this comes as no surprise, knowing fully well that a former minister of health was once quoted telling doctors that they can become tailors, farmers, or anything else that they want to be if they are not satisfied practicing as medical doctors.
I decided that I was not doing clinical medicine anymore. I decided I'm not doing anything clinical anymore. Why? The workload is exhausting. It's not that bad that I have to finish work maybe around 6 or 7. I have to hit the traffic again, back to my house, go back early in the morning again. It's just too much.
At the same time, we have a situation where Nigerian politicians travel to seek healthcare services abroad, leaving their citizens to languish in an abandoned and forgotten healthcare system that they have, either deliberately or not, designed to keep a nation sick and its health workers frustrated.
If you as a politician, you don't have faith in your own healthcare system, it says a lot. Not just that the healthcare is failing, it says that you yourself as a politician, you are a failure. It's an insult, a big insult to the healthcare in Nigeria, a big insult, and it's a shame, big shame to all of them.
In the end, who pays the ultimate price for this anyhowness? It is not the Nigerian politician who can travel to London on a private jet to seek medical care services. It's not even the medical doctor who can make a decision to seek greener pastures and Japa to a country where their services are better valued. It is you, the Nigerian patient. For every second the government ignores this crisis, for every promises that are broken, a life is lost. So many patients who are already stranded will even be further stranded by this strike, especially knowing that Nigeria has one of the worst poverty indices on the planet.
I want you to know that this fight we are fighting is a fight for everybody. It's not just a fight for us. A tired doctor is a frustrated doctor, is a dangerous doctor. I'm sure you don't want a dangerous doctor treating your children. You don't want a tired doctor operating on your wife. You don't want a tired doctor operating on your relative. no, you don't want that. This is the best time for you to join us. Say something. Let your word speak. We care about you and we love you all.
We need to move from empty words into concrete action, from broken promises into intentional reforms and development. It is important that political leaders, starting from the Minister of Health, understand the true level of the infrastructure decay and take necessary action.
That what advice will I give him as the coordinating Minister of Health and Social Welfare? Like I said previously, that I will just tell him to do his job decisively. That's all. The Federal Ministry of Health and Social Welfare has all this. There is even a Department of Statistics there. So they have all the statistics in this world. You know, it will interest you to know that in August last year, this same coordinating Minister of Health released a policy paper on combating health workforce immigration. By itself, a 58-page paper. It will interest you to know that they have all the answers in black and white. As a matter of fact, if on the compensation, this chapter 3 of that policy paper talks about incentives and compensation. If what is under the incentives and compensation, if they can do everything there, I probably don't think the Japa problem will not be solved like 60%. And even people abroad will be impressed. So probably give coming back home a thought.
So where do we go from here? The strike is not the disease. It is the symptom of the disease. It is the final, desperate, septic shock of a system that is dying and decaying. We were once a nation that treated Saudi royalty in UCH Ibadan. Today, we are a nation that cannot pay its doctors a global standard living wage, encouraging them with actionable reforms that give them courage to stay behind and save Nigerian lives. Today, we are a nation that are forced to pay its lawmakers some of the highest salaries in the world, yet starves its hospitals from basic latex gloves and oxygen tanks and defibrillators. According to the Lancet Commission, every $1 invested into the health system yields $9 to $20 in economic returns. But the real returns isn't in naira or dollars. It's in the lives that are not lost. It's in the mother who successfully survives childbirth. It's in the man who survives a heart attack. It's in the mind of the young doctor who makes a deliberate choice to train in Nigeria and stay in Nigeria. The government has failed to bail the cat. And this problem isn't just the problem for doctors to solve. The question now is that will we, the citizens, demand that the government does bail the cat and save the Nigerian healthcare system? If you've watched to the end of this video, I want to say a very big thank you. Thank you for watching. Please don't forget to subscribe, like this video, and share it with someone. Let's rebuild the Nigerian healthcare system before it's too late.